So the next thing we're going to do is increase your range of motion in supination. So supination is this movement here, bringing your palm to the ceiling. So what we're going to do to stretch that is you're going to do just that. Bring your palm to the ceiling, take your other hand, reach underneath, grab in between your web space here, and continue to pull yourself into that direction. Now don't bring your arm too close to your body. Try and keep it out straight to get more of an intense stretch here. So once you get to about your end range where you can't stretch anymore, hold it for 1 minute. After 1 minute, relax and do that again 2 more times. So you're gonna do this 3 times for 1 minute.
Hi Janet, I hope everything's going well. So today we're going to go over a couple of stretches to help go over physical therapy. So I have my assistant here today, Christina. We're going to go over one stretch right now. It's called the wrist extensor stretch. So bring your hand out straight like this. We're going to drop it down. And then take your other hand and you're going to apply force to the back of your hand. Like that. And you're going to hold it there for about 2 sets of 30 seconds. And then from there, when this becomes too easy, we can progress it to having your hand down, and we're going to rotate your hand outward, and then apply force to the back of your hand again, and hold again for, let's say, 3 sets of 45 seconds. So the next stretch we're going to go over is the flexor stretch for the wrist. So again, I have my assistant here, Christina. So again, we're going to bring our arm out like this, and we're going to raise your hand up, and then you're going to apply force to the front of your hand and push backwards. We're going to again hold this for 2 sets of 30 seconds, and when this becomes too easy, we can do another progression where hand out, and we're going to rotate your hand towards the thumb side, and again, apply pressure to where the knuckle area is and push back. Again, we can use this for 3 sets of 45 seconds.
So I'm going to show a radial nerve glide. So what we're going to do is sit up nice and tall, and then we're going to take our left arm and we're going to hold it out like this, twist and have our fingers straight and pointing up towards the ceiling with our palm facing up, and then we can progress this by tilting our head to the opposite side. And we could even go like this, bring it in and back out. And we can do this 10 times. Now I will show a median nerve glide. So what we will do is sit up nice and tall, have our fist in a neutral position, and then we're going to extend our fingers and our thumb so they are straight. Then what we're going to do is we're going to tilt our hand back, keeping those fingers and thumb straight, and then we're going to rotate so we're pointing straight ahead, and then what we're going to do is we're going to extend, and you should feel it all along the median nerve. We're going to do this like 5 to 10 times because this one can be pretty aggressive for some people.
Hope everything is going well at home and you feel confident with the exercises and stretches given to you. The final thing I wanted to discuss with you before we log off our session is just some education. Since your treatment was cut short in the clinic due to COVID-19, I wanted to discuss some general guidelines. First, with the given exercises, I want you to perform them 3 times a week. Resistance and weights can be increased as time progresses, but I don't want you to progress too soon. A good way to determine if you're ready is after a week of staying at the same weight and you are not sore after the 3rd session, you can increase slightly. For exercises given to you as 2 sets of 10, you can try 2 sets of 15, and so forth. For anything involving weights, increase by 1.5 or 1 pounds at a time. Keep the wrists moving, but not too much. You don't want to overdo it. It is best to be compliant with your exercises and stretches in order for you to return to your normal activities, especially since your treatment with me in the clinic was cut short. Finally, I just wanted to discuss some precautions for you to be cautious with the use of your wrist. With your history of osteoporosis, you are more susceptible to fractures. Your healing time is also going to be increased. With increased healing time, although you are out of your cast, you still have healing that needs to occur with the surrounding musculature and ligaments around the original fracture in your radius. Overall, as I said earlier, doing your exercises and stretches will give you the best chance at a great outcome in regards to being able to lift a gallon of milk and raising a coffee cup to your mouth. If you have any questions or concern regarding your physical therapy progressions or any complications that arise, please contact me. Good luck, Janet, and I look forward to hearing from you soon.